And welcome to Off the Couch, where psychology meets everyday life. I'm Dr. Greg Cason, psychologist. I'm here with producer Brian Gomez.
Happy Monday, you guys.
And also we have Jamie on the board. Hi, Jamie.
Hi, guys. How are we?
It's pretty good, but today, Jamie, Brian, we have a very special episode. You've probably seen the internet has already broken. Is that what it's already done? Broken several times about the murder of a UnitedHealthcare CEO, Brian Thompson, on December 4th in 2024 in cold blood in New York City. He was walking to an investor convention. The thing about this is we saw that it didn't spark sympathy for many Americans. In fact, very few, except for a few pundits on like some news programs that I saw, but certainly on the internet, I didn't see any. But we're going to talk about that. In fact, we saw people sparking a public outrage about, what do you think? Health insurance. This highlighted deep divisions in America's views on the healthcare industry. So today in Off the Couch, we're going to talk about the murder of Brian Thompson. We're going to talk about the person who they've now captured. We're going to talk about attitudes towards healthcare and how much suffering is going on with people who have healthcare. And the main version of this show, we're going to tell you why people seek vengeance. Now, we don't really know what's driven the suspect. We don't really know his exact reasons. I think a lot of things can be deduced, but we don't have confirmation. But nonetheless, vengeance may have been a motivator, a pretty likely motivator. So I'm going to actually go down and look at why do people seek vengeance. But first, let's talk about the reaction to the murderer. So Brian Thompson, 50, this is the person who was the victim. Brian Thompson, 50, was shot in public while in New York for an investor convention. In fact, he was walking to the investor convention. And I think what's notable about walking to an investor convention, he's walking to the people who are going to be making a whole lot of money on his company. They're investing a lot of money, and they're going to be making a lot of money based on this. And we're going to talk about private health care and how they make money, which is different than, say, public options. The shooter escaped on a bicycle, but a suspect is in custody. The suspect, now an arrest has been made. That was just today. Luigi Mangione, 26, was arrested in a McDonald's in Altoona, Pennsylvania, after an employee recognized him and called authorities at about 9:15 a.m. You know, I had to say, just thinking about the person who called the authorities, I'm thinking, they're going to get a nice reward, but also I'm sure they're going to get a lot of pushback and blowback from people in their lives or people on the internet, which I think speaks to the moment we're in right now. On social media, a man named Luigi Mangione posted pictures of his travels with friends and family. And a person with the same name attended a private high school in the Baltimore area where he wrestled and became valedictorian. So he's a smarty. He's a smarty, and he's also very athletic. And he graduated from the University of Pennsylvania in 2020 with a degree in engineering, according to the school commencement program. By the way, University of Pennsylvania is one of the Ivy League schools. It is an extremely exclusive school. It's a good school. You graduate with a degree in engineering, which is one of the more difficult degrees. This was a very, very smart guy. So let's talk about the victim for a moment. There was a statement put out that he'd be remembered by his leadership, but also it's noted that he will be many criticized UnitedHealthcare's high claim denial rates. So let's talk about it, because UnitedHealthcare actually stands alone in that they are the worst culprit in denying prior authorizations or denying claims to the company. So let's talk about how these companies make money. The private companies make money because people pay their premiums in, And so they get a big pool of money. And then their product is with insurance that they're going to pay money out for health expenditures. So people go see a doctor, and the doctor bills the insurance company, and the insurance company then pays the doctor. Well, they have a whole strategy that if they can limit the amount of money that they pay out, the company makes more money. So certain companies have mastered that, whether with algorithms or different strategies like denying claims, which we're going to talk about, or just delay. As a provider, I can tell you that's a very common one. Well, they'll just sit on things, or they'll send you a letter saying that something was due to them, and you'll receive the letter, and the due date that something was due to them was the week previous. I mean, that kind of craziness. So often you, as a provider, to help patients get reimbursed or to help yourself get reimbursed, you have to get on a merry-go-round where you spend a lot of time on the phone calling and talking to people and trying to advocate for people. So on the provider side, it is just as onerous. But I think on the patient side, it's even worse because why? Patients are sick. And patients actually, when they're sick, don't feel like wrestling with an insurance company. So the denial process, some people just give up. In fact, maybe most do. So let's look at claim denial rates by insurance company. UnitedHealthcare, I have a graph. So UnitedHealthcare is at the very bottom. UnitedHealthcare has a 32% denial rate. That's 1/3 of claims that come in are denied right off the bat. They're just denied. The industry average is 16%. The best provider of them all is Kaiser Permanente, which has a 7% denial rate. I believe Kaiser Permanente on this list is the only nonprofit provider. But Kaiser Permanente has its own problems. As I think I've said before, I'm a patient of Kaiser. I believe they're a good provider, but I do believe they have some significant problems that are reflected in the insurance industry. But they have some of the lowest insurance denial rates. Part of that is their model, I'm wondering, because they have what's called a captured HMO model where you basically go see their doctors, you pay them, you see their doctors, their hospitals, their medications, etc. But all of that allows them to keep costs very low. UnitedHealthcare just seems to take the approach of using different strategies to make it onerous for people to get reimbursements or for providers to get reimbursements so that people eventually give up and don't get the care that they need.
It's pretty messed up.
Do you guys have bad insurance experiences?
Well, I belong to Kaiser as well, so I don't have to deal with that.
Yeah. That is one advantage.
But I have always looked at like health insurance as like a pyramid scheme. That's how I've always just looked at it.
Well, certainly in the private healthcare, the thing about nonprofit, they have to put their profits back into the organization. So they have to put it back for capital expenditure. I don't know how they all do it, but they have to put it back into the organization. In the private world, you pay investors, you pay profits. Like UnitedHealthcare on the stock market has long been a star. They've been soaring through the roof. They've been doing extremely well as all the other healthcare companies. So they've done so they restrict care through various means. They'll always say they don't do that. They'll always say they put patients first, but they do it through these kind of trick. They put up a very complicated maze to try to get through, and if you get through it, great. But if you don't, well, then you're not going to get your money.
And even if you get through it, you might still get denied.
Well, you might still get denied. In fact, sometimes they use a different strategy. This is kind of an interesting one, that some people will get repeated denials because they'll lose sort of the ability, because the emotional and strength to keep fighting these denials. So they'll get a denial here and a denial there and a denial here and a denial there. And this happens to people who are suffering from either chronic or severe, more difficult conditions. So it can be a very problematic thing. And the insurance company too, I've been looking into this a little bit, which I think complicates things, is because we have this weird thing in our society. We have some public healthcare systems. We have the VA, which is the most efficient, most well-run, best liked of all the healthcare system, which is very interesting because I hear a lot of people put down the VA, and the VA has its struggles too. I've worked there. I've worked at 2 different VAs, so I can tell you from the inside there are some reasons. But I also know that the VA has incredible providers, and when they put money behind something, they put good money, and it's done very well. The other big one is Medicare. Medicare, of course, is socialized medicine. It's government-provided medicine for people over 65. So those are the two. They're both extremely popular, well-run programs, both highly efficient, save the government a lot of money. Medicare Advantage, though, although it has that name Medicare, it's not Medicare. They pay the Medicare Advantage companies to then manage Medicare. And the Medicare Advantage companies, I think, didn't prepare the stat, but I think it's something like Medicare Advantage companies cost every person who are enrolled in them cost the government $1,400 more a year on average. So the Medicare Advantage companies end up billing more than Medicare, which is really kind of a fascinating thing, number one. But they also make their money by restricting care more than you would be restricted under Medicare. So this is kind of one of the difficult things. And like Kaiser, I'm happy with Kaiser. I thought, when I go to Medicare, would I be enrolling in Kaiser? Because they have a Medicare Advantage program. And I'm not really sure. Because although I'm satisfied with them, I know of this shortcoming. And this shortcoming is probably a huge one. I mean, it's a big one for me. But people are enrolled in Medicare Advantage for all the major insurance companies, Cigna, UnitedHealthcare, Humana. Those are some of the biggest. And they actually will then, they'll be probably happy in the beginning with these companies because they're good when you're healthy. But when they really need something, then problems start to set in.
I'm curious to figure out what the story is behind the shooter and like what was the motive for that,
Well, we're going to get into that. I'm sorry to spend time. I just wanted to kind of lay out the problem with the healthcare insurance companies. Let's talk about the healthcare CEO compensation. I think this was interesting to me because Brian Thompson didn't even make the most money. He only made $10.2 million a year. Only. So, that's an incredible sum. But like Cigna made $21 million a year, Molina Healthcare 21.4, CVS Health 21.6, Humana 16.3, and we can go down the line. What I did too, because I'm a member of Kaiser and it's nonprofit, so I'm like, nonprofit, they're going to do it best. So I looked up the CEO there. And it was also in this range. I think it was 16 million or something a year, yeah. So it really disappointed me quite a bit. But of course, a nonprofit can pay their executives. It's just part of the budget. But I have to say
that's crazy, yeah.
Because that money can be used for care.
Or, a lot more staff.
More staff, could pay off medical debts. I mean, we could look at all the uses of this kind of money. So it was just a concern to have seen that. So let's look at the public reaction to this man's death. This is to Brian Thompson's death. Social media exploded with satirical and critical commentary about the health insurance industry. I have one tweet that says, "Will his family be billed?" Another, sending prior authorization, denied claims, collections, and prayers to his family. Another, did the ER wait to render care until they confirmed coverage? It's a good question. because having been to an ER and having to sit there as it got pre-authorized before they could see me, I remember that process, and I was so sick I couldn't understand at the time
That's insane.
why this had to be pre-authorized. That was over at Cedars. It was not Kaiser. And another person wrote, was his trip to the ER really emergent? Well, like, was it life or death? It was going to get worse. According to his company, my husband's heart attack wasn't actually an emergency, and we were out $3,000 the full deductible. Oh, this poor woman. I'm sorry. Another one by a therapist. This is from Daniel, but it's blacked out name. As a practicing therapist, hearing about the news that the CEO of UnitedHealthcare was killed, I just hope his family knows that grief counseling isn't considered medically necessary and is not covered by UnitedHealthcare insurance before they get hit by any unexpected bills.
Wow.
That is actually true.
I mean, but I'm glad they said it.
Yeah.
Wow.
What do you have, Brian? You found some?
Oh, there's so many. I mean, I feel like we've been all having a blast with this. It says the shot was not pre-authorized and was out of network. Claim denied. The bullet was a pre-existing condition. This proves nothing. So it's like a lot of the comments are just riffing them apart with like
the very
their
language
own
they
language.
use.
Yeah. Which is kind of, I mean, my take on it is like, I'm glad this needed to happen.
Well, I wasn't glad. In fact, I was a little stunned by, that this happened. But I mean, almost immediately I thought, oh yeah. As a provider, I have to say, I kind of went, oh yeah, someone's disgruntled. I didn't think it was personal. I mean, not like, I didn't think it was somebody who he cheated on his wife with, or, like her husband or something. I mean, I didn't think any of that. I just thought, oh yeah, this is a disgruntled customer.
And that's why I'm like, I'm curious to see what the reasoning was behind it. Like, I want to know the story, when it all comes out of like, what caused this guy to go and kill him,
Well, we have a few hints written on his shell casings. The shell casings were the words deny, defend, and depose. Deny, defend, and depose. These words were on the bullets echo the title of a 2010 book called Delay, Deny, Defend: Why Insurance Companies Don't Pay Claims and What You Can Do About It. By the way, delay, deny, defend is the common insurance strategy that they use. They will delay, they'll just delay things, and that's probably the most profitable thing they can do. They can deny, of course, keep the treatment away, and then they can defend themselves in course, or defend the, lack of treatment, etc. And I've talked to amazing people on the other end in healthcare insurance. It really is kind of a mixed bag. Some of them are amazing, super helpful, caring, and some of them cold as ice. It's pretty interesting. And, I think that the people who are on the other end of the phone, most of the customer service people, they're good people. They're like not well paid. They're just doing their job. But these decisions are coming up from higher than them. That's what I think. There are some structural issues in healthcare. Healthcare is accused of overbilling Medicare and denying care through an algorithmic process. We've talked about it. Everyone's talked about algorithms. They're just the if-then process, and they figure out ways to deny claims. Critics have highlighted systemic inequalities and the financial burden placed on patients. Delay, deny, defend. Okay, so I found this kind of interesting sort of understanding that what insurance companies are engaging in is something that is considered structural violence. This was actually new to me. A Norwegian sociologist, Johan Galtung, introduced the concept of structural violence in 1969. The framework categorizes violence into physical and or psychological, active or passive, intentional or unintended, and manifest or latent. Oh my goodness. But bottom line is structural violence can happen just about anywhere. Galtung emphasizes that violence can occur without direct actor and can harm objects or humans. So this is considered structural violence. I'll go down a little bit. Structural violence, or societal focus and examples of structural violence, it highlights the challenge of addressing indirect and systemic harm. So when the insurance companies are actually designing these policies to make them the most money, they have to do so by denying care, which ends up causing harm to the very patients that pay them money to reimburse their care. So this is a pretty good example, but the stark contrast between societal outrage over vandalism and the indifference to systemic harm, like extreme poverty or climate-related deaths, were examples of structural violence. But I thought the insurance company one was much, much bigger.
No, yeah, I agree.
So one outcome of December 4th, the actions later that day, Anthem Blue Cross had decided to put out an anesthesia policy. Oh my goodness, Anthem, what bad timing. Anthem, they put out an anesthesia policy and then they had to pull it back almost immediately. Anthem Blue Cross Shield won't pay for the complete duration of anesthesia for patients in surgical procedures. That was their policy that they're putting out. Essentially what they were saying, and they're saying we're following medical guidelines. One thing about medical guidelines don't mean medical limits. Medical guidelines are just that. They're sort of like, this should take about 2 hours. If a surgery is going to take about 2 hours, Anthem was saying we'll only pay for 2 hours of surgery. It wasn't a guideline is not a limit. That's what I was so shocked by this, because if a surgery is going to be 2 hours and 15 minutes, Anthem wasn't going to pay for that extra 15 minutes of anesthesia. Have you ever woken up on an operating table?
No.
Have you?
No,
Jim?
thank God. Thank God.
No, I haven't, but I actually have Anthem Blue Cross Blue Shield, and after seeing this, I was very nervous, definitely a little worried.
Well, they did pull back. Doesn't mean they're
too.
not going to do something else in the future. But I have woken up. I have did on a operating table. It didn't scare me. It hurt. It hurt a lot. And I was like, I remember lying there, and I was like, oh, I got to tell the surgeons that I'm awake, because I could hear them and their discussion and everything, and it was hurting so much. And I just had to start going, I am awake. And then I panicked and then put me back under. So that was the end of that.
That's scary. That's like a huge fear. Like I would kill myself at that point. Be like, no, can't go through this.
You're under anesthesia, so you don't. I don't know if I just couldn't feel anxiety, but I didn't feel anxiety. Like I knew where I was and I knew what was going on.
Does anesthesia help with that? Does it help with your anxiety?
It depends on the anesthesia.
I don't know, because when I got my tonsils taken out, I got put under and I freaked out.
That was the gas?
Yeah.
Oh, okay.
And I was freaking out because I was like, I can't open my eyes. Like I felt my body just shut down, and I freaked out right before passing out.
Oh my God.
Well, we all react to anesthesia differently as well.
Sure.
And different anesthesias react to different people differently. So this is why we need anesthesiologists. They are the experts in that particular area. But anyway, it's just shocking that they decided to. They proposed a policy limiting reimbursements for anesthesia based on preset time limits. That's the thing. I mean, people in the profession were freaking out. The American Society of Anesthesiologists called this dangerous and arbitrary, a profit-driven decision at the expense of patient care. I mean, yeah, surgeons highlighted that anesthesia duration depends on the complexity of the procedure. You don't always know when you go in on a surgery how things are going to last, how long they're going to last. So, this is just something terrible. Yeah.
No, that's why I'm glad this murder happened, because I know it sounds horrible, but it's like it's teaching these companies like you can't just go around and screw like society over without paying anything.
Well, here's the bad news. I don't know that it's going to teach anything. I think it's going to teach them to have security details. I don't think it's going to teach them to stop wanting profit. And I want to keep talking about how much Americans are suffering, because they've known about this problem for years. It's just gotten worse. That's all. but this problem has been around for years. So let's talk about medical costs in America. 1 in 4 insured Americans struggles with insurance costs, struggles with medical costs. 1 in 4 insured Americans. Something like 8% of people right now, I think it's 7.9%, are completely uninsured, don't have any insurance whatsoever. And that's really unfortunate. But the 1 in 4 still struggle. It's 25% struggle with insurance costs, skipping essential care and prescriptions. Key findings from this study I found: 57% skipped or delayed care due to cost. 57%. 44% carry medical debt. I was one of those people for many years till I finally got it paid off. I went to an ER. I was in a car crash, got knocked out. They carted me off to an ER, and what do you know? I got a bill. Afterwards that wasn't covered by my insurance. And I'm like, I was a student. I didn't have any money. So I had to carry that bill till I finally did. 23% of insured Americans have plans with high out-of-pocket costs. Those are very common right now, the high deductible, high out-of-pocket. And 1/3 of those with chronic conditions cannot afford prescriptions. What are chronic conditions? Oh, I don't know. Diabetes. I mean, things that are very important. That's why, trying to get insulin down to $15 a vial, that was an accomplishment of the current administration. Unfortunately, is about to go because they were the first to allow Medicare negotiation to do $15 insulin. Just these really necessary things, because otherwise people were having to ration their insulin because it was so expensive.
How much does that usually go for?
I don't know, because I didn't really, but I think it was like $200 or whatever people were having to pay, $300. Like, it was a good amount. But, I have no idea, unfortunately. I don't know the exact amount. Sorry to say.
I just looked it up. I think average out-of-pocket cost in 2019 was $58.
Oh, okay. Much less than I thought, thank God.
But yeah, still a lot for a lot of people that can't afford that.
But there were times it spiked up, I think.
I'm sure it's been more than that.
The impact of medical debt: over 1/3 of insured or uninsured adults face medical or dental debt. Thank you, Jamie, for looking that up, by the way. Nearly half owe $2,000 or more. 21% owe $5,000 or more. That's 1/5. Financial strain worsens health outcomes and delays treatment. Is that not intuitive? When you're under financial stress, it's going to make your medical problems worse. And it doesn't just affect patients. It also affects delays in care. This was a study I found by the American Society for Radiology and Oncology survey. Radiation oncology, these are cancer docs, essentially, from 2024. They did a nationwide survey of 750 radiation oncologists, and it revealed that the severe impact of prior authorization policies on cancer care. 92% of oncologists report treatment delays. Oncologists, cancer treatment. When you delay cancer treatment, cancer advances. It's basically how it works. 30% of these oncologists cite emergency room visits or hospitalizations that were caused by the delays. 7% attribute patient deaths to prior authorization delays. And 33% report patients abandoning their radiation treatments. Again, like we talked about, sometimes people are so sick and it takes so long that they just kind of give up. And this is the thing that providers will often complain about. 85% report increased administrative workload. 94% cite prior authorization as a cause of staff burnout. And you have to hire extra staff just to handle processing. I'm not an insurance provider. If I were, I would have to settle for lower reimbursements, and I'd have to hire somebody to try to get me those reimbursements because it is onerous to do that. And I still have to get on the phone with insurance companies for out-of-network, and I'd still have to, if I was in-network and even hired somebody. It's just part of the process that we have. So does all of this have an effect? Yes, we are not living longer. How about that? let's look at life expectancies. In the developed world, the United States is not doing well. We are at the, of this list of Western countries, we are in Japan. We are in the bottom. We have an average life expectancy of 74.8 years for men and 80.2 years for women. The average for these Western countries in Japan would be 80 years for men and 84 years for women. So we're really struggling to stay up there. Now we look at the views of these kinds of healthcare, and I thought this was interesting, which was the view of the ACA, or the Affordable Care Act. I don't want to get into this too much, but the Affordable Care Act is this private insurance exchange that was developed because people like myself, or people who did not work for a company, couldn't get health insurance. Or, you would get it and they would cancel it the minute you got something. It was just a very, very high, very onerous process, and they would raise your rates like dramatically. Just if they wanted to kick you off the plan, they wouldn't just kick you off. They'd make your plan would suddenly be $1,000 a month, or, who knows? That was 20 years ago plus. But this was Obama put in this Affordable Care Act, which allowed for private insurance to have these contracts, but the government dictated many of the terms that they had to abide by, including not that you could qualify for the insurance regardless of pre-existing conditions. And this is pretty important because somebody who's had cancer in their past, or had HIV, or who had any number of conditions that might exclude them, including things like depression. And that one always used to floor me, is when somebody had depression, they'd often get denied. And then they would try to kick them off of getting insurance, but the Affordable Care Act does allow it. Is it a great policy? No, we need better. But is it better than nothing? Hell yes. So it just was interesting here. Unfortunately, it's become so politicized, and I put this up, 62% of Americans are satisfied with the Affordable Care Act, which is not fair. Compares favorably to Medicaid, which is 76%, and Medicare, which is 81%. But what was interesting is when they looked at party differences, Democrats liked it, 90%, and Republicans really did not like it, 29%. I don't know if they're all working for great companies or whatever, but I think there might be a lot of misunderstanding about it. I'm very, very grateful to have the Affordable Care Act policy, because I don't know that I would be able to have a policy otherwise.
That's scary.
Well, it's just the reality of the healthcare world.
It's kind of crazy just how big that split is, like 90% to 30%.
Yes.
Like, it's crazy.
Well, because it's constantly politicized. Instead of just going, okay, this is the Affordable Care Act, this is what was agreed to. In fact, it was the Republican senator, I remember when all this was being negotiated, who kept pushing back, who did not want a public option. They are very much against Medicare for all, which would make a great deal of sense for, if we were to really look at actually reimbursements, et cetera. So the bottom line about all of this is, it is unfortunate it got politicized, because healthcare should never be politicized. Healthcare should be something that every single person in the United States has access to and can afford. I mean, when I lived in France, I got sick. Somebody came to my apartment. I couldn't believe this. Came to my apartment, and I paid him like, I don't know what, nothing. But, I couldn't understand almost anything he said, but it was still fascinating to me.
And you felt better after? He did his job?
Yeah. Well, I don't know. I mean, I had some kind of, I think, viral something. I mean, I was sick, but at least he didn't think it was too bad. There you go. So, and when I was in Mexico, this is another interesting thing. I was stung by a stingray, and that was pretty bad. There was a hospital across the street, and the hotel staff said, "Don't go to the hospital." And they said, "Go to your room. We'll send a doctor up," and they did. And the guy was amazing. So,
Did they say why not go to the hospital?
they wouldn't tell me, but they were implying it wouldn't be good.
They're like, you're not going to come out of it.
My guy was great.
Yeah.
I'm sure that would have been fine. I've been in other ERs in Mexico. I took a patient to an ER in Mexico, and I thought they were just operated like any other ER, actually, here in the United States. So I didn't see any difference. Yeah. But anyway, why people do it. Let's talk about the complex behavior of vengeance. Okay, so what are the psychological factors? You asked this, Brian. I think this is an extremely important. Like, why might someone do this? We're going to talk about several factors that might lead someone to do this. But we just talked about the problem, and I think if you understand the problem, you understand there's going to be motivation out there. So it may be a personal story, and he may realize this reflects a bigger issue, So I don't know. So psychological factors, it could be an emotional response like anger, betrayal, humiliation, can drive revenge seeking. When I look at patients, I have a certain equation that I teach them to recognize anger. Usually with anger, it's a belief the other person has done something wrong, that they're a bad person for having done it, and they need to be punished or taught a lesson. So in this particular regard, we can see if this is going with what the shell casings said that they recovered at the scene, that this is being punished or taught a lesson, teaching a lesson to the wider group and punishing one, I guess. But this is kind of a shocking play out of how you actually see anger expressed when it's carried out on somebody. There's also a desire for control. Retaliation may help regain autonomy and address perceived wrongs. Actually, I was going to present a study too, but it was just too much. That they can show that elephants actually maraud, or they go and they stampede villages when the people in the villages are abusive or act poorly toward the elephants. That the elephants will then go and punish the town. And they looked at this research of why are elephants carrying out revenge? And they seem to follow the very same model that humans do.
Wow. I love elephants even more now.
Oh my goodness.
What?
I don't think
need to be taught lessons.
Let's talk about the social. I actually don't agree that people need to be taught lessons or whatever. I don't think I'm not a fan of him being killed, but I 100% understand people's outrage. I 100% understand that. It's like, yeah, duh. In fact, I think the people that don't understand it may have the privilege of not having to deal with the healthcare system at the level that we do. And lucky them. So societal and cultural influences, honor and reputation. In some cultures, revenge is tied to maintaining honor. I think this could also be with us. Retribution could be seen as a moral obligation. This could be like with us, like humiliation caused by someone stealing your girl. And so that you go and punish them. Also, biological considerations. Do you know that there's a neurological reward system? We can anticipate in our brain that revenge will reward us, and then it does. Yeah. This can create a sense of pleasure and reinforcing the behavior. You want to do more. One thing I found really fascinating was personality factors. A study led by Dr. David Chester, psychology professor at the Virginia Commonwealth University, explores personality traits tied to revenge-seeking behaviors. And the research identifies sadism as a dominant trait among those who enjoy hurting others and seeking retribution. Think, I don't know, political candidates who say they want to put people in jail. You know, sadism is maybe an operating factor. Consequences of seeking revenge. We do know that there's immediate gratification, but unfortunately for the people who seek revenge, it often has long-term effects. There's a saying that I really like. I think I heard it, first by, who was the woman who played Princess Leia? Carrie Fisher. Carrie Fisher said this in her comedy act, but I always thought it was quite brilliant. She said, Revenge is like drinking poison and hoping the other person dies.
Dang.
I always thought that was good. I think it's a popular saying in AA as well. Seeking revenge prolongs negative emotions and perpetuates cycles of conflict. And we could talk about this another day when we talk about anger. But the more you express anger, oddly, the more you get angry. So it really does, you have to process anger differently. There are some alternative approaches to anger, effective communication, resolving conflicts through dialogue. I mean, insurance companies. I thought this was good. That might be good interpersonally if I have someone on my level standing there. But I don't know that it would work with insurance companies because you're always chasing them. Acceptance and forgiveness. Reducing the desire for revenge. I think this is what people are resorted to when they're denied care. And constructive outlets. Channeling emotions into positive activities. And if there's any activity I think would be positive is if people didn't just post TikTok videos, but actually banded together in the streets and maybe protested in front of these healthcare companies, maybe wrote to their congressperson or senator or called them or did protests, those types of things. Those types of channeling do have an effect. Because right now, like I said, I think all that these CEOs are going to do are hire more security. I don't know that they're going to change their business practices. I mean, Anthem did because its timing was just about as bad as you can imagine. They put out that policy the day this guy's killed, so they pulled it back.
But see, he did make something happen.
He did make some. You're technically correct. You mean he being Luigi Mangione?
Yes, the killer. Yes, he definitely.
Well, we don't know that it was him, but the suspect.
The suspect.
Yeah, we don't actually know it was him.
Hopefully, they got the wrong guy.
Why?
Because I feel like he didn't deserve to go to jail.
Well,
I know that sounds bad. Yeah, he killed somebody, but like, I don't know. I feel like society at this point is starting to like snap to where it's like they're not gonna tolerate things being unfair and being taken advantage of.
No, I do think that is correct.
You know,
I do think that is correct, and I think it's being fueled, unfortunately, by some very nefarious forces. Because I do think we as a society need to band together, but we're constantly being told the haves and the have-nots, and if you don't hate this person, then you're a have-not. You know, like it's almost this forced division. So I struggle with that, honestly. I do struggle with that. I don't think
anyone deserves to get murdered. Yes,
he's going to go to jail probably.
Yeah. Well, I mean, I had this question. Do you think this would become a trend then? Like if people are seeing like...
I don't see it that way. There are copycats and probably maybe because he's good looking and so kind of polished and there's been so much love, well educated, and people really identify that if this is his issue, this is an issue that caught fire publicly. So there are copycats, but I don't know. I mean, I'd have to wait and see, but I don't see it that way. I guess I see that, in fact, this issue finally broke open. Because it's been there. We've always been complaining about it. But it's been like, your thing got denied? Huh.
And I think people get beaten down by the system so much
I
that
think you're right.
they don't even bother to take action at that point. They're like, I just give up on this completely, you know?
Yeah.
That's why I'm like curious to see what his story was that motivated him so hard to go that far, that most people just never do that, you know? Because it doesn't happen, or else I don't think these healthcare companies would be running around, you know, taking advantage of society.
I'll be very curious about it. And if there's a mental component, I'll talk about it later, because this is the age range. Well, he's 26. He's a little old, but there are different conditions that can
like
not necessarily urge this exact behavior, but can urge on behavior. Like if you're already having an issue, and then things can undo. We'll have to wait and see. But right now, at least what we saw with the shell casings, with the action, with the cold-bloodedness at an investor meeting, I mean, it was timed, everything.
The kid was smart.
This was something that they knew was going to happen. The laying in wait, the whole thing. But if there's a mental component, we'll see. But it didn't look like an impulsive action.
No, it seemed very well thought out.
Yeah.
You know, I mean, even if like the shells having all the, you know.
Everything. Well, I found this MLK quote that I think captured the mood of what's going on with people, that the country has welfare for the rich. The person put social welfare. But country has welfare for the rich and rugged individualism for the poor. That's an MLK Jr. quote. And I think that's, something we all have to think about. We have to help the least of us. We have to help the least of us. And the people that are the least of us are the sickest, the people who are the poorest, the people who maybe their mental capacity is not all there. We have to help everyone. That'll raise us all up.
And I think people, like, it's not that we hate, like, rich people or anything like that. I think we hate the fact that rich people aren't doing things to help other people that need help.
Well, I don't know
that the funds that they have.
Knowing a lot of rich people who do things to help other people, and I do think there are many, many good people out there. But I think what you're saying is there's so much corporate greed, and there's so much systemic so many systemic problems, and here like corporate welfare, where they, the corporations get huge pockets of money, like with these healthcare organizations getting government funds at a higher rate than is in the regular Medicare program for Medicare Advantage, which gets less benefits than a regular Medicare program. It's concerning.
Yeah.
So.
Well, at least somebody's standing up. I'm sorry. Just kidding. But no, I mean, that's just my point of view on it, honestly. And if people don't agree to it, then...
Well, I appreciate you representing your point of view. And thank you as well, Jamie. That wraps up the show for today. Reminder to like, subscribe, and give us 5 stars. Go to this, we didn't have any. Well, we have a couple of studies. Go to youtube.com/Dr. Greg. You can see the survey information. Also, if you have questions or topics, hit us up on socials at Ask Dr. Greg. This is Dr. Greg, Brian, and Jamie bidding you farewell. Until tomorrow, until next time, be present, be flexible, and be kind.